And speaking of violence, I think majority of the times there might be cases of violence, but they're very subtle that, you know, might not even term them as violence, right?
Yeah.
And Marlene, do you want to paint that picture in terms of what, like, when we're talking about violence, and especially against women and girls? I mean, you've mentioned some, but what are some of these other subtle forms of violence that might not be really regarded as violence, but still, at the end of the day, you know, equate as violence?
So what we're saying actually currently is that gender-based violence is rooted in gender equality.
Yeah.
So violence is violence. There's no violence that is not good enough to be reported. And one of the challenges that we are actually facing right now is a lack of data of basically some of these violence incidences that are happening during emergencies at the community level, because also there's that stigma and attitude on how you will be viewed after you go and report that you have been sexually harassed or gender-based violence during that moment of, let's say, there's a drought incident or floods, and you're asked to move to a safer place. And what happens is that it's one tent where everyone is actually put up there. So women, girls, men, all elderly people, and everyone is there. So at that point, all women are actually exposed, women and girls, even the elderly and the sick. And any form of violence is violence, even just someone touching you inappropriately in that setup, that is violence, because and currently in these 16 days of activism, we are saying that gender-based violence is actually violating human rights. So we need to feel safe in whatever space that we are in, and don't feel like, okay, and don't feel also judged that if something happens, you'll be told it's because you are in this kind of environment, or you look like you are, you know. So violence is violence, and that is why we, as CARE, our vision in terms of trying to eradicate poverty and also social injustices, we try to implement programs that support women empowerment while at it, and providing them that space to make decisions about the issues that they're actually facing on the ground. And we know through that intervention, then we're able to design programs that are actually speaking to the needs of the women and girls at that level, where they can speak about what the key challenges that they're actually facing, that we think it's not violence, but for them it's violence because there's an aspect of mental health that really comes with these issues of violence, however small it is. And we've seen people who've been exposed to this violence when they grow up, they're now trying to speak about it because it's actually affecting even how they relate with different genders. So I think from CARE's perspective, violence is violence, and therefore through our programs implementation, we're trying to support both men, boys and girls to be able to have the equality in terms of accessing equal opportunities, equal education opportunities, employment opportunities, decision making, because that is where we see a lot of violence exposure. Currently, we know most men hold the decision influencing power holding roles. And therefore, if you do not have women also at that space to help provide the current scenario, what's happening, and how the decisions can be provided that support them, that builds them, then they will continue to be exposed in this violence, and which is cross-cutting against a number of issues, be it emergency, be it climate change, be it pandemic, COVID, we saw the situation, in any other context. So women and girls most of the time are usually disadvantaged because of the power influence that most of them, especially in vulnerable communities, do not have.